So my name is Sebastian Crutch and I'm a neuropsychologist and Alzheimer's Research UK Senior Research Fellow based here at the Dementia Research Centre at UCL's Institute of Neurology. My big research question is looking at the atypical presentations of Alzheimer's disease, so really understanding how one disease like Alzheimer's can affect different people in so many different ways. Most people think of Alzheimer's disease as being a disorder of memory and attention, and I work with a big group of people where actually the disease attacks the back of the brain first and so it affects their visual function. So these are people whose memory and insight is fine, but they have great difficulty seeing what and where things are. We've been looking particularly to characterise these rarer variants of Alzheimer's disease, so to understand both in terms of their behaviour, the clinical problems they experience in everyday life, and in terms of changes on their structural brain imaging, how we can divide and diagnose and group and understand the differences between these conditions. But then we want to get more to the basic mechanisms of what are the factors which are driving this disease into or protecting it from being driven into different parts of the brain, and hoping that by looking at these people with rarer forms of Alzheimer's disease, that will tell us important things about Alzheimer's disease as a whole. My research is important for society because for many years dementia has been dismissed as something that inevitably happens as we get older, and working here with younger people with dementia, mainly in their 50s and early 60s, you see that that's clearly not the case, and actually a lot of people who experience the conditions such as Alzheimer's disease and other causes of dementia at a young age it has a very different impact on their lives. So we need to treat and diagnose and find ways of coping and managing with these conditions in a very different way to that in which you would with a typical 90-year-old with memory problems.